Hi everybody, my name's Noreen and I've got an awful name of a title, Principal Service Development Manager. But basically I work in the sexual health team with Nari, if you know her, and Rose Foster. And Rose isn't able to be here today, so I pulled the short straw and I'm having to present. So apologies in advance if I'm not as good as Rose, because I'm nowhere near as knowledgeable as Rose is about anything. Here we go. It's not working. Go. So this is a high-level summary of the HIV Action Plan priorities for this year. And I think most of you probably have seen this before. We're really talking about 4 focus areas that we'll go through very quickly because an awful lot is happening this year. And if anybody's any questions, feel free to grab me after the presentation, or else you'll all be very hungry on this afternoon tea. So the first section is surveillance, information and knowledge systems. The bulk of this work is actually led by the Ministry of Health, not Health New Zealand. And the key thing that a lot of people are waiting for is the HIV monitoring plan, which we thought we would be able to have published by June this year. But unfortunately, the data wasn't available until July, so we hope to have it later on by between October and December of this year. A lot of the data for that is coming from the SPOTS behaviour research. And also we're getting the data from Sue's team in Dunedin. The Public Health Agency in Ministry of Health also commissioned modelling of a HIV prevalence in New Zealand by the HIV epidemiology group that Sue's in, and they have been tasked with conducting a large systematic review and coming up with an appropriate method for New Zealand to use for modelling of the rates of HIV, and that is no mean feat. So yeah, I'm not jealous of their task, but I'm sure they will do it extremely well. The other key action of the PHA was to progress the audit of antenatal screening. And the purpose of this was to identify the gaps in screening for HIV and syphilis that we know that are occurring in regions throughout the country. This has been held up initially by privacy impact assessments between the agencies, and now it's being held up with data sharing agreements. So it's full of legalities, but the team hope to publish a Northern Region report using the data that they have collated over time, as long as they can access that data. So that is still ongoing, but that is the most hopeful we have. And then as soon as the data agreements are agreed, then it will be a national programme that will be identifying where the gaps are. And now we come to SPOTS, which everybody knows is led by Peter Saxton in the Behaviour Surveillance Programme that is a collaboration between the University of Auckland and the Burnett Foundation. And this is a repeat of the previous one. We're running it this year, 2025, and then we'll be repeating it in 2027. A lot of the data from SPOTS will be going into the monitoring report. And we really are keen to get this report because we have had the wonderful Julia Scott run a report and tell us that this will give us our really good early indicators of trends that will monitor patterns in prevention and testing practices and hopefully allow us to direct focus on funding to deliver services where they're going to have the greatest impact. And they have done an amazing job. They started the repeat of SPOTS at the Big Gay Out in February this year, and they have over 3,000 participants, and that's after cleaning the data up. And Peter will give you a much more in-depth summary of the findings tomorrow. But he has done a really wonderful job, and his team, they presented at the STI and HIV World Congress, and they've recently published the SPOTS Fieldwork Report. No, I think I might have jumped on. And within Health New Zealand, the Aurora Maori Services Group are looking at Maori data sovereignty. And due to the major changes that everybody's very aware of in Health New Zealand, this has been put on hold. And currently, the team are looking to either progress with an open or closed RFP or a procurement process to contract a provider that will deliver this mahi in a timely way, where they're putting Māori at the forefront of development. And this is quite difficult to find a Māori group that have this level of expertise and knowledge, but hopefully that will be beginning very soon. So the next section is about prevention and health promotion, which is primarily led by the Health New Zealand team. And as you've, the Harora Māori Services team are leading a lot of this, and they're leading a community-led social marketing campaign, and they have recently signed a contract with a creative agency working collaboratively with a Harora Māori provider. And they hope to have their campaign go live in 2026. And the whole focus of this campaign is to promote combination prevention, because we know from the data that Māori populations are not using the preventative means as well as non-Māori. And we come to testing and linkage to care. And you've already been given a wonderful summary of what's been done and what was requested in the open procurement process, so I'm really pleased that you went before me. Thank you. You did a great job explaining why we undertook an open procurement process and why we wanted to expand it so that we could have more testing being delivered to people that need it the most, because we know that looking for HIV cases is a bit of looking for a needle in a haystack. So we want to make sure that the approach is targeted, and that we are going to find the people that are going to test positive without having to conduct a couple of 100,000 tests to find that one. So we're looking at those people that, like body positive, that are going out into the community. They have their networks, they're doing peer-led testing. We want an increase in by Māori for Māori testing. We want a promotion of self-testing, because there's strong evidence to say there's lots of people that we prefer the anonymity of self-testing and the convenience, especially in rural areas. And we also wanted to increase the workforce so that more people would be able to deliver the testing and expand our wings. In addition to all of that, as we talked about, we wanted it in the priority populations. And very importantly with this work, we wanted to make sure that the stigma associated with HIV and STI testing was reduced, well, preferably removed, and it's normalised. So when people go into a healthcare facility, it's no different than asking for another test, and people shouldn't be feeling embarrassed that they feel they have to do so. And there should be more knowledge about the prevalence of these infections and why we need to do testing. The impact of this should be that we will, if more testing is done, more people that are testing positive are found and can commence treatment, well then there will be a reduction in locally acquired infections. By doing that, we'll improve the Māori health and well-being as part of the Te Tiriti obligations, and this will improve our surveillance. And we're really delighted. It was not an easy task. There were a lot of very good proposals, but we feel we've done a really good job in progressing to get 8 contracts in place. And they're a combination of ADIOS, needle exchange providers. We've got Huria Trust. You know, and you've heard about the wonderful work that Body Positive has already started doing. So they are first off the ranks in delivering. We've got Positive Women are working with Whatu to deliver extensive training as well. And then we've got Rakaora is another Māori by Māori facility in Kaitaia, where they will be expanding their knowledge and getting a really at-need target, and it's really good to see them here. So if there's unfamiliar faces, they may be our new providers that have joined the community. In addition, we've got, really excited to say, we are developing a national free online STI testing by sexual wellbeing. And that is in development, and very exciting, I think, for a very targeted market to have the Youth One-Stop Shop in Rotorua deliver their service, where we know that that is really meeting people that are young, vulnerable, and have no clue about what they're doing. So we're optimistic that that will result in much better consequences for everybody. And we're hoping that this will be supported by recruitment of more contact tracers and sexual health specialist roles in each of the regions, and our team supporting the regions in trying to deliver this. And in July, Auckland were first off the ranks, and they have advertised for 2 contact tracers to join their team, and hopefully soon the other regions will be joining them. Now, talking about the support for people living with HIV, addressing the significant issues caused by stigma and discrimination. There's a wonderful creative agency called VML. They were successful in procurement to deliver this national HIV campaign. And they are currently out testing creative concepts with different parts of the community. They've identified people in the general public that have moderate to high levels of stigma and discrimination, and they're testing the impact of the different creative concepts they put to them, and then they're going back to them a week later to see what's landed, what have they remembered, and what actually made an impact, which I think is really good, rather than just doing a one-stop quick analysis of what their first thoughts are. So their primary job is to shift people's attitudes towards HIV and stop them stigmatising and behaving ways that make people's lives not very nice. Oh, this is a bit weird. And the flow-on effect is that people living with HIV won't feel judged and ashamed and will have a much better quality of life. And the audience is just about everybody. And where we're at, well, we've come from over a year of building what was phase 1, where we had people living with HIV and the one clinical person, he's in the room, in a working group to come with some starting strategy. And that benchmark survey then was fed into VML's work, and they're currently, as I say, they've created some testing and they're now testing it with key groups, and that hopefully will be refined further depending on what the feedback is that they get. It'll get more audience testing, and then as long as they get approval within Health New Zealand, they progress with producing the assets, and the campaign should be going live in October. So it's very exciting and it's coming up very fast, actually far too fast. To get the information to build on the insights from phase 1, VML conducted some research. The general public sample was over 1,000 people, and it was identified that 25% of people have high levels of HIV-related stigma. And it should be noted that this was self-reported, so it's probably higher. 50% and above have either high to moderate levels of stigma, and people are still believing in transmission myths. It was a very high percentage that transmission was thought to be just by touching, by sweat, by going to the gym. The survey of the health sector, unfortunately, we only got 322 people. So I'm a bit disappointed in that, because we did reach out to most health providers. And so this has to be taken with a grain of salt a little bit, because the population size is so small. The difference in the results, though, was quite marked. There were much people who self-reported everything. 11% only had moderate to high levels of stigma, so significantly less than general population. And most of those people, their stigma related from misunderstanding of how it was transmitted. Whereas with the general population, it was also to do with morality, with long-term outcomes, and everything to do with HIV that was completely lacking in knowledge. And the insights from this will help direct the campaign so that it really tries to pick on where can we change behaviour the most. Interesting, the findings of the people in the health sector was actually quite different to Sue's findings in aged care, and we did ask for aged care as well, but the sample size was really small. My other key study works, this is a bit more interesting. We ran a campaign at the same time as the procurement for the HIV action plan, the HIV campaign. We also ran a procurement to build awareness of syphilis. Now, this campaign was really to address the fact that the rates of syphilis are much, much higher for Maori and Pacific, and we wanted to targeting that campaign, and we really want to abolish the fact that there is any congenital syphilis in New Zealand, because it's something that shouldn't be happening. The winners of this were Curative, and they designed posters and some assets with some working groups of Pacific and Maori young people that were from around the country, and you're going to be the first public group that's seen them, because they're about to be published and shared. And we want to launch this campaign on World Sexual Health Day on the 4th of September. But please say you like them, because if you don't, nothing's happening. They're signed off now. But if anybody really wants them, that's in the public area, please come to me, because we are going to be printing a run. And first in, first serve, we'll get some printed and delivered to you if you give me your details. So, the campaign's called Syphilis Ain't It. The feedback from the working group was, we want the language clear, we want it not medical, and we want it to quickly and easily tell us what to do. They didn't want anything that looked in the slightest like Health New Zealand. And if you look closely at those nails, it spells out, get tested. This person is going to be the spokesperson for the campaign, so there will be a PR element going with it. She's a nurse in the Auckland Sexual Health Clinic, and she's incredibly beautiful, she's incredibly brave, and she's spreading the message. So, yeah, so she looks really, I think they look great, but I love green. So she's calling out to young women. This is calling out the young man, or the older man, whatever man, and it's exactly the same message. If you're having sex, get tested. What does she call out is, it says in the smaller text, syphilis is in our community. It can be passed on to sexual partners and unborn children, and that ain't cool. Okay, and then she read it here. But detection means protection for you and your whānau. You may have no symptoms, but if you're getting it, ask for a quick blood test. And then the QR code, if they scan it, will take them to the site to say where they can go and get tested. Okay? So it's quick, it's simple. Well, it's not simple, it wasn't. I couldn't do it in a million years, but it was simple for them. It's a simple message. It's been really well tested with our key audience, and it's sunk really well. So then for the couples, no, we're not. I've got them in the wrong order. So this wonderful lady was about to give birth the next week. So, and this was the day of the gale force winds and the storms. So their selection of where to have their sites and beautiful scenic spots around Auckland ended up all being indoors, because I think it was horizontal rain. And so it was the end of test, but she looks amazing, and she's saying again, syphilis ain't it. But this message is slightly different. Syphilis is in our community. It can be passed on to sexual partners and unborn children, and that ain't cute. But detection means protection for you and your pepe and your whānau. You may have no symptoms, but if you're pregnant or planning a pregnancy, ask for a quick blood test. So I was trying to get the message across. It's a blood test, not a smear, and it's really important if you're pregnant. No, I missed out one. I don't know where it went. So there was one for couples. I'll just see if I just double expand. Yep, there's it. So this is the couple one, and it's the same message. Syphilis ain't it. If you're having sex, get tested. On the side, you see I've got a mobile phone. There will be a short social media campaign. For each of these, it will have a 6-second, because apparently that's the maximum scroll time now that you can get somebody's attention. So 6 seconds, and they were just shot while they were taking these photographs. This is an actual couple, so they're having a bit of fun together, really relaxed, and obviously their messages get tested on the T-shirt, and then the messaging in the 6-second scrolls is basically them laughing, having a good time, and just calling out the words of the poster: syphilis ain't it, if you're having sex, get tested. So they're quick and short and suitable for our concentration span at the moment. And that is the four things. Now, that's way more exciting for me than the next bit, but this follows on from the wonderful presentation that we had earlier about Fiji. And it's a summary of information that we got from not Health New Zealand, but it's New Zealand Foreign Affairs and Trade. And it's summarising the response. So I was asked to share this with you. I was talking about, in July, the $4 million was given to support Fiji's HIV response. And that funding is for the surge strategy and the outbreak response. And they're working, as you've just heard, to reduce HIV transmission, improve access, and combat stigma and discrimination. It's also supporting the HIV response through existing health investments. It's got a lab strengthening activity. And then it's talking about sexual and reproductive health and rights investment. So I'll leave it up. Anybody wants to read it, I think you can all read. It's all about testing pre and post, and then United Nations Population Fund supported to help implement Fiji's reproductive, maternal, newborn, child and adolescent health. And the funding, apart from what's in this, it's totally up to Fiji services to decide what they're going to spend it on, and New Zealand hasn't said specifically other than what's in these slides. And the idea is that increasing the HIV rates doesn't just help Fiji, it helps the whole region, and that MFAT are currently engaging with the health partners to support how we can make a more coordinated response, and that it does align with Pacific-led priorities. And that is me, totally finished.